Good evening, everyone. Welcome to today's Cell Talk webinar. Today, our speaker Shreya will be delivering a topic on the effect of long term care insurance on healthcare utilization of middle aged and older adults. So, Shreya is a data analyst intern at Renex Life Sciences. She is currently focused on gathering information about professors' research interests and related data. Additionally, she works on various projects that involve collecting diverse information. Shreya is pursuing BBA from DEI Agra and has previously worked as an operations trainee at Brainology startup. There, her main responsibility included working with e-commerce portals. At Renex Life Sciences, Shreya enhanced her experience in gathering data and also developed skills in time management. I welcome the Shreya to deliver this topic.
Hello everyone. So today's topic of the sector presentation is effect of long-term care insurance and healthcare utilization of middle-aged and older adults. Its original author is Yang Songho. So it comes under the topic longevity, and it was selected from the journal International Journal for Equity in Health with an impact factor of 4.8, and it was published in the year 2023. So this research basically has impact on three things: longevity, cost management, and enhanced elderly care. So as we all know, like China, many countries are facing rapidly increase in aging population. So China was the first one which necessitated effective long-term care solutions. So this research examines how long-term care insurance affects healthcare utilization, specifically hospitalizations and outpatient services. So outpatient services is basically like services which don't exceed 24 hours. Like it can be normal 4 to 5 hours operation without need of hospitalization, or it can be normal visits to doctor. So, like in healthcare demand, we all can see there is an increase in chronic disease in healthcare, like elderly people. So, it increased the need for comprehensive healthcare and support services and cost management. If these services, like if the diseases are not managed properly, then it can be led to high cost. Then they are like their children might face like they have to admit to hospitals. So the financial burden comes there. So it is necessary to come with a long-term care insurance. So China's in context, rapidly growing elderly population and implementation of insurance in pilot cities to manage care needs effectively. So China like evaluate the effect of insurance policies in different well-educated cities. So present challenges are like there are hospitalization rates which are very high, and also the outpatient services are also very high. And there is an uncertainty about how the new policies will affect healthcare utilization, whether it will reduce the need for hospitalization or whether it will increase the need of outpatient services. So the researchers had need to evaluate the impact on both hospital and outpatient services. The objective of the research. The objectives were to assess the impact of new care policies on obstetricians and outpatient services among middle-aged and elderly in China. They also provided suggestions for improving policy implementation based on findings. Methodology. Data was collected from 2015 and 2018 based on the China Health and Retirement Longitudinal Study. So CHARLS is basically a study which is conducted, which collects data of 45 years and older health and retirement data, which can be used for economic research. So it focused on participants aged 45 years and older only. And they also use difference in deficit with propensity score matching. So this method is an approach like which used to evaluate the changes over time without any policy interventions. So it aligned policy implementation timing with data collection periods. Also, they applied propensity score matching to ensure comparable groups by matching participants based on similar characteristics. Like they can be characteristics like health status or income level. So all were similar characteristics only. They also align policy implementation timing with CHARLS data collection periods for accurate comparison. These were the results. This plot shows that before matching, they were the two groups that was treatment and control. They had very different propensity scores. But when the treatment and control got matched, their scores become more similar, forming a normal distribution. In DIT results, 61 samples from the treatment group and 5950 from the control group were analyzed. The results were like LTCI significantly it reduced annual hospitalizations and cost, but it did not significantly change the number of monthly outpatient visits or the cost. Like people are still visiting outpatient visits, but also they come to more like independent care. They will come to like house care, home care only. So LTCI significantly reduced the number and cost of annual hospitalizations for middle-aged and elderly people. It did not significantly affect the number of monthly outpatient visits or the cost. The reduction in hospitalization was very significant in eastern China than in central and western regions. Because in eastern China, the people were more educated, but in central and western regions, the people were low educated. So they didn't had knowledge about the long-term care insurance. So it doesn't have any impact of people with low education and no care assistance, but what's effective for other groups. So the new care policies effectively reduced the number and cost of hospitalizations, but did not significantly impact outpatient services. So it can, if to like provide long-term care insurance to low educated area also, they can like policymakers can spread the information through programs like can conduct medical health fairs or can provide personal assistance and help in paperwork. So there will be greater benefits observed in Eastern China among those with higher education levels or care assistance. So the policies were less effective for low education and attendant individuals, suggesting a need for tailored interventions to ensure these groups also benefit. Like if they also can benefit from long-term care insurance, they will be also like can reduce the cost of hospitalizations and can enjoy like independent care and yes, can also conduct programs for them or workshops for them. Like also policymakers can expand coverage by including hospitalizations and outpatient services in the policy and integrate social security, like provide most of the services at home only without needing the need of hospitalization and can enhance resources like can introduce telemedicine to meet the better needs of aging population. So, impact of the research. It demonstrates potential for reducing hospitalization cost, contributing to more sustainable healthcare system. It also guides enhancement in elderly care and support systems. Thank you. You can find me at share@lenix.org.
Thank you, Shreya, for your detailed talk. Now, floor is open for audience questions. So, here is the first question. What were the reasons for regional differences in the outcome?
Regional differences were like they were health status, income level, low and high was there.
Okay. And one
No,
more question. Is there any gender based study?
no, there was no gender-based study. Only health status and income.
Okay. Hope you got the answers. Thank you, Shreya, for answering the questions. Before I conclude this webinar, I would like to inform you all that next. Can you move to the next slide, Shreya? So I would like to inform you all that next presentation will be given by Divya Lakshmi Ramakrishna on physical activity as a stronger correlation with heart rate stiffness than strength, balance, or BMI in an older population. This presentation will be on 12th June 2024. Thank you for your kind attention.